Employees in the healthcare field are subject to many safety principles and rules for safe work practices. Thus, healthcare workers are essentially the most important part of any safety program. As a healthcare worker, you may come across unique and possibly fatal hazards every day. This program will show you how to protect yourself from some of the most common of these hazards. This program is not a comprehensive training program for each topic covered. Its purpose is to provide an accurate but brief overview of the various topics discussed. Your employer will provide more in-depth training on those safety hazards which you might encounter on a more frequent basis. The content of this training program are safety attitudes, slips, trips, and falls, musculoskeletal disorders, back safety and safe lifting techniques, fire safety, electrical safety, hazardous chemicals, personal protective equipment, also referred to as PPE, blood-borne pathogens, needle sticks, handling medical waste, good housekeeping. Safety attitudes are one of the most important aspects of any safety program. A positive safety attitude is evident by the behavior of an employee. When a worker is on the lookout for potential hazards and taking steps to eliminate those hazards is a good indicator of a positive safety attitude. It is important that all employees keep alert to their surroundings for possible safety hazards. If you detect or see a potential safety hazard, then you should take immediate steps to correct the problem or notify your supervisor or other employee who can correct the problem. Employees with positive safety attitudes generally display work behaviors and characteristics, such as being alert to their surroundings and having the ability to identify hazards and ways to prevent them, being focused on the task at hand, following safety rules and procedures, taking personal responsibility to ensure their safety as well as their co-workers. You can reduce your risk of injury from slips, trips, and falls if you are aware of your surroundings. You should always look where you are walking and take short, slow steps to maintain your center of balance. Not paying attention can lead to a fall. Be aware of these common hazards: wet or slippery floors, loose or torn carpet, cords, poor lighting, trash, or debris. One of the most important steps to preventing slips, trips, and falls is to wear appropriate, comfortable shoes with good traction and support. This will not only prevent slips, but will also help your back. Each day, many healthcare workers place significant strain on their backs in the course of their work. Rates of musculoskeletal injuries from overexertion in healthcare occupations are among the highest of all U.S. industries. The single greatest risk factor for overexertion injuries in healthcare workers is the manual lifting, moving, and repositioning of patients. To avoid back injury, stay physically fit and maintain good posture. When lifting or moving a patient, utilize devices such as slide boards, slip sheets, slings, rollers, belts, and mechanical or electric hoist whenever possible. Equipment such as adjustable beds, shower chairs, raised toilet seats, and grab bars can also help by allowing a patient to assist the employee during the transfer or move. If you need to raise a patient up in bed, first lower the head of the bed and ask the patient to raise their knees and help by pushing if possible. When performing bedside tasks, move alongside the patient's bed instead of reaching across them. Even with the use of such devices and equipment, it is still important to use proper lifting techniques. Remember to plan ahead, stand close to the patient or object being lifted, keep your back straight and bend at the knees, Lift the patient or object close to your body. Lift with your leg muscles, not your back or arm muscles. Avoid twisting, and never lift a load higher than your waist. If you need help lifting or moving a patient or load, always ask for it. It is better to get help than to injure your back. The best method of fire safety is fire prevention. There are some things employees should and shouldn't do to help prevent workplace fires. These include: keep the workplace free of trash or other combustible materials. Never overload electrical circuits. Destroy and discard damaged electrical cords. And be cautious around oxygen or flammable gas cylinders. Do not allow sparks or flames in areas using oxygen or flammable gases. Not only should employees take steps to prevent fires, they should also be prepared in case of a fire. Know the location of all emergency exits and fire alarms. Learn how and when to operate fire extinguishers. Never touch or open any door without first testing the amount of heat radiating from it. Stay low to the floor to avoid inhaling too much smoke. Remember, smoke and heat are just as deadly as flames. Your actions may save the lives of those around you. Be prepared. During a fire emergency, you should remember the 4 A's. Activate the fire alarm and/or contact 911. Assist others in exiting the building. Attempt to extinguish the fire. Assemble in the predetermined location outside of the building. Only attempt to extinguish a fire when the fire is small and contained. You are safe from toxic smoke. You have a means of escape, and your instincts tell you it is okay. You must know how to use an extinguisher before attempting to extinguish a fire. Make sure you are using the correct extinguisher, or it could actually spread the fire. Use the pass system. Pull the pin by the handle. Aim the hose of the extinguisher at the base of the fire. Squeeze the trigger and sweep side to side. Many workers are unaware of the potential for electrical hazards present in their work environment. A variety of possible solutions may be implemented to reduce or eliminate the risk of injury associated with electrical work. Remember to always check electrical cords for damage before using. Do not use damaged equipment and report it to your supervisor. Never work around electricity when you or your surroundings are wet. It is advisable to use ground fault circuit interrupters, GFCIs, on any cord that has the potential of getting wet. If you receive a shock or tingle when working around electrical cord sets, tools, or equipment, report it immediately to your supervisor. Keep cords away from heat and water. Never run cords across walkways, under rugs, or through doorways. Never use damaged outlets, adapters that let you plug extra cords into an outlet, or 3-to-2 grounding adapters. Don't use any electrical device that blows a fuse, trips a circuit breaker, shocks, or appears damaged. Follow the manufacturer's instructions when using electrical equipment. When repairing a machine or tool, follow your company's lockout/tagout procedure. Healthcare facilities have many different types of hazardous substances, including cleaning and sanitizing chemicals, as well as medications. Your employer will train you on the specific types of substances you may come in contact with. And additional information about these chemicals is located in your company's safety data sheet binder. This binder contains helpful information about every chemical in your workplace, such as what happens when substances are mixed, how to dispose of hazardous substances, what first aid to give in case of an emergency. Your employer will tell you the location of the safety data sheets. When dealing with a chemical, employees should take training seriously and pay attention. Read labels and safety data sheets. Know where to find the safety data sheets. Use appropriate PPE. Know correct emergency procedures. Use safe work habits. For consumer products such as window cleaner, toilet bowl cleaner, and dishwashing liquid, when used in the same manner and with the same duration and frequency that a normal household consumer would use them at home, employees should follow the safety guidelines printed on the container. Personal protective equipment is a vital barrier between your body and possible health and safety hazards. PPE may include gowns, aprons, goggles, face shields, mouthpieces, CPR barriers, disposable single-use gloves. All disposable PPE should be properly discarded immediately after use. Any torn or punctured PPE should also be immediately discarded and replaced. It is important not to contaminate your skin while removing PPE. When removing gloves, pull one glove off from the outside top and hold in gloved hand. With exposed hand, peel second glove down from top, tucking first glove inside second. Do not use your bare skin to touch the outside of either glove. Immediately wash your hands after removing your gloves. Remember, no barrier is 100% effective, so always wash thoroughly between each patient. This is for your health as well as the patient's. OSHA requires your employer to develop an exposure control plan to help protect all employees from exposure to bloodborne diseases such as HIV and hepatitis B. Employers must offer the hepatitis B vaccine to all employees who have occupational exposure to bloodborne pathogens. As a general rule, employees should treat all medical waste and blood as if it were contaminated and take appropriate safety precautions. This is commonly referred to as universal precautions. Do not eat, drink, smoke, apply cosmetics, or handle contact lenses in any area where there is a reasonable likelihood of contamination. Do not keep food or drink in refrigerators or other areas where blood or other potentially infectious materials are present. Minimize splashing, spraying, and spattering when performing procedures involving blood or other potentially infectious materials. Separate and label all medical waste at the source. Use separate containers for each type of waste. Remember, red or red-orange colored labels, bags, or containers with the biohazard symbol warn you that the contents are biohazardous materials and to use caution when handling the containers. Needle sticks are one of the most common ways diseases are transmitted on the job. Do not bend, recap, shear, or break needles and other sharps. Place all sharps in an appropriate, puncture-resistant, leak-proof, color-coded container immediately after use. Blood and other bodily fluids can carry viruses, bacteria, drug-resistant organisms, and radioactive waste. Therefore, it is important that all medical waste related to patient care be treated as potentially hazardous. All laundry or waste should be handled with minimal agitation and disposed of in the appropriate containers. Good housekeeping is a very important part of workplace safety. It is your responsibility to keep your work area clean. Your facility's exposure control plan lists specific methods and schedules for cleaning surfaces that may become contaminated. Here are some general housekeeping rules. Protective coverings on equipment and surfaces must be replaced if contaminated at the end of the work shift. All non-disposable surfaces must be properly disinfected or sterilized in accordance with your facility's cleaning procedures. Working in a healthcare facility has many hazards, which many employees take for granted. It is important you understand the hazards and take appropriate action to keep yourself and your fellow workers safe. Never take shortcuts when doing your job. Follow all rules your employer has set forth, and most importantly, if you think doing something seems unsafe, then don't do the job. Remember, safety begins with you and your fellow workers.